All right, you ready?
Yeah.
I guess I'm gonna put my mask on. We live? Don't we get everybody busy? Are we going?
We're going. We're
right.
live.
There's fitness, so we have medical director, Vein11 treatment centers. You're gonna meet Christina. She has terrible discomfort and pain in her right leg from big varicose vein. We're gonna do a thermal ablation today. Okay. And when we do the official filming of our second episode on Monday in just a few days, we're going to feature ultrasound guided foam sclerotherapy, which is the future of vein care available today. Unfortunately, it's not performed by enough vein care practitioners in this country. Friends don't let friends get vein surgery. We look forward to featuring Christina when we get rid of her big snaky green vein on her leg on Monday. Stay tuned. But before we do that, we're going to thermally ablate a large vein under the skin in her upper thigh. Come on in. All right, Christina, start out with the baby. You know how Hollywood is. So this is Christina, 69 lady. Why don't you tell us about yourself? What you do, where you're from, and what's going on with your legs?
Well, my name is Christina. I'm 46. I'm here from Florida, lived in Florida my whole life. I am married for 25 years, have 3 kids who are 20, 17, and 14. And they're the reason I'm here, because when I was pregnant, I think that I gained a lot of weight. I had huge babies. They were all like over 10 pounds, and I got the varicose veins. So about 10 years ago, I went to try to get it checked into, see if I could get my veins done, and I wanted to do the stripping. It was a lot of downtime.
Oh, no, not surgery.
No, it was a lot of downtime, and I just didn't have the time for that, and interest when I covered, and I knew there was a lot of advancements being made, so I thought I'd come check you out, see what we could do.
And so it was divine intervention. There's no role for surgery and superficial vein disease as far as we're concerned here at Vein11. What we're looking at over here is Mickey Mouse. Everybody see Mickey Mouse? That's a landmark. So there's an artery, common femoral vein, a superficial, or rather the great saphenous vein junction right there. And when it's not perfect. That's a little more perfect, Mickey. When I crush Mickey, okay, the artery is pulsing there on the left side. Anyway, I'm a recovering detail guy, assistant professor, and I tend to over preach and teach. So I'll try to avoid that. But this big thing right here is saying it's prayers. That's her big, gigantic, great saphenous vein that's saying, oh no, Vein11's coming to get me. So anyway, where I'm following all the way down into her knee area. And Bailey, one of our fabulous ultrasound technologists, is doing the handiwork with the camera. So any compliments, please send them to Bailey. Any criticisms, you send to Bailey. So anyway, we're now looking at that big vein kind of lengthwise. And pinch. We're going to give you a little pinch right there. This is a needle the size of a hair shaft. We don't hurt anybody here. No one's ever hit us, cussed or left or not gone on to a second leg. Our black hood stays in the car all the time. There are things you can do so you don't hurt people. And Christina, if Sophie or Bailey hurt you, you let me know. Okay, because we're a team. And what we might want, even though we usually have 70s music going on in here, or I get very nervous, we should probably turn that off or we'll get some kind of copyright problems. So anyway, you can see the wire going in the vein there. And we're using the Seldinger technique. We call it the Seldinger technique. Seldinger invented it. 1953, Swedish doctor. It's how we get into veins all the time. And arteries and bodily organs and all sorts of stuff. So we put a needle in the vessel, and then we put a wire to the needle, and then we put a little catheter over the wire, and we can get very safely and stuff. Anyways, so I'm going to bring this up here, and then we're going to put a little, it's mostly saline, a little bit of lidocaine around this vein. That's what we're doing here. And it's going to sound like a sewing machine for those who are of a certain age who remember what a sewing machine looks like. Everybody hear me okay? I can mumble sometimes. So it sounds a lot like a sewing machine, but it's not. Sophie, can you tilt her back just a little bit? So we're going to actually not go other direction. There we go. So we're not sewing Christina up here. We're putting a little bit of time around her vein there so she doesn't hurt. So, oh, people love watching the gross stuff. So this is the gross stuff. Oh my God, is he going to stick that big thing in her leg? Oh my God. Oh, I can't believe it. Christina, how you doing?
I'm good.
She's just fine. Okay, so there's a little pressure there. Now we're going to use put in the thermal ablation device, which is about the size of spaghetti. And this big thick vein goes, right under the skin there. So it feels like a butterfly going in. I used to say spider, but that didn't go over very well. So it's a butterfly. And I'm going to come over here. And I'm just going to batten down the hatch here with my thermal ablation device. And I know we got viewers out there. This is the first time we're doing this, ladies and gentlemen, and we just thought we'd kick it off with Christina. And, I could do an hour-long didactic speech about venous insufficiency and treatment and all that stuff, but we just figured it would be just a lot better to show a patient, have them tell their story, and show you what we do. So vein disease is really leak in the attic, flood in the basement. That's all it is. It is not smoke and mirrors. It is easy for a fourth grader to understand. It's mostly genetic, so you can eat right and exercise. Let's increase the depth there a bit. You can eat right and exercise till you're blue in the face and get vein disease, okay? I don't care how much broccoli you eat. It's kind of like glasses, okay? You can eat all the carrots you want. And if your eyes are going bad, they're going bad. So it is genetic, and that's one of the many reasons it's very satisfying to help people, because they really didn't do anything to deserve it, but picked the wrong patients. Pinch, pinch, pinch. How's Sophie doing? Is she hurting you, Christina?
I'm good.
Awesome. Awesome. Are you taking any happy medicine or anything?
No.
Okay.
I'm just happy.
A lot of well, you are happy, and this is pretty typical for our procedures here. Honestly, if you know what you're doing, people aren't going to hurt when you do these procedures. So again, we're just putting a bunch of saline around the vein, and Bailey, you could show the ultrasound. Ultrasound looks like balled up newspaper if you don't know what you're looking at. Bailey, why don't you show them what they're looking at since you're an ultrasound tech? Gonna point to it. So you can see my needle going back and forth. Oh my God, it's so big. Okay, why don't you do that, and I'll keep stealing here. So if we look right here, it looks a little bit like a target. And in the very middle there is the catheter inside that big pipey vein that we started out with there. And the dark stuff that looks like marbling on a steak is actually the fluid. And so we're putting fluid around the vein so she doesn't pinch, pinch, scream bloody murder. When we turn on the thermal device, because the thermal device is going to get very hot, and it's going to elegantly cauterize this vein. So it's going to turn off the leak in the attic. So if we turn off the leak in the attic, then the flood in the basement gets better. and that's vein disease. What we tend to see and feel is about at the knee level and below. But the problem starts really high up, like up in the groin area, up where Mickey Mouse was. Pinch, pinch. So we're about 80% done here. And Bailey and Sophie are doing pretty good. So we are a team here. So we don't take all the glory, but we don't take all the pain either. So we do share it. And I've slept a lot better over the years when I've shared it with everybody who's in the room. But I'm not going to take all the glory and I don't feel better either. So again, we're just putting a cylinder of fluid around the diseased vein that already has a catheter in it. And you can see the needle tip. You can actually even see the bevel on the needle. That's how good that ultrasound is. And we're putting a cylinder of fluid around this vein. I'm going to come back up here to where Mickey is, and you can see that Mickey has a Q-tip in his ear. I just made that up. See the Q-tip? Ew, we're cleaning out his right ear. Ew, get out of there. So we're pulling back the Q-tip. In this case, we would be pulling it out of his ear, but he's got kind of a trumpet in his ear, but that's actually the vein. So anyway, we're going to pull it back here and keep going. Christina, what do you think so far?
That's pretty close. Okay.
All right. So we're going to do one last pinchy here. Pinch, pinch, pinch. Boom. Oh, yeah. Show it good, Bailey. People like to see the needles and stuff. Of course, we don't use needles here. Right, Sophie? What do we use? Instruments. Yes. They're not needles. They're instruments. So, okay. Here we go. Temperature, please. 25. Okay. So that should be it for potential torture. Can you turn on the device, please? But your part's done, Christina, but we're going to be done in about 3 or 4 minutes. So the chirping you hear over there is the thermal ablation device, or the red hot poker, getting really hot right now. And Christina's enjoying the show because we've put all that tumescent anesthesia in there. So she shouldn't feel anything. Rarely people will feel something. And if they do, we'll put in a little more anesthetic. So do we have the whole world watching or 2 people?
A couple.
Oh, okay. All right. That's okay. This is a great case. So we are going to, one more. All right. So we're basically elegantly cooking the inside of this vein, or cauterizing it. So we're going to turn off the leak in the attic, and then Christina's flood in the basement's going to get better. And boy, does she have a flood in the basement. It looks like a green tree snake crawling around the back of her calf. And that's what we're going to focus on Monday for the official 2nd episode of the Vein11 reality TV show. So why are we doing a reality TV show? Because way too many people suffer and don't get the right answers from their doctors, and we're trying to fix that. Again, vein disease, very common, affects around 50% of Americans, certainly before they die. Causes all sorts of symptoms: itching, aches, pains, cramping, heaviness, restless legs, night cramps. Did you know that? Restless legs and night cramps. So vein disease can actually affect your sleep and your energy levels. It can cause skin changes. It can cause ulcers. And last but not least, it can cause swelling. So swelling is not a normal part of the aging process. Don't let any doctor tell you that. The leading cause of swelling in this country is undiagnosed, untreated vein disease. You can have really good looking legs and have advanced venous insufficiency. We commonly refer to it as varicose veins, which unfortunately I don't like referring it to it as, because half of people that I see don't have a bulging varicose vein, yet they have very serious symptoms and are suffering. And that's one of the many patient vignettes that we're going to be featuring on the show. Just because you have fairly good looking legs does not mean that you don't have significant vein disease and symptoms that you could be seeing all sorts of other doctors for. That's actually venous. So yes, ankle swelling, not a normal part of the aging process. Probably the second leading cause of ankle swelling in the country is medication related. There's a fair number of medications that can cause ankle swelling, but that is far less than the number of people with swelling due to venous disease. Here's the problem. Well, I don't see that many people with ankle swelling, Dr. Pittman. That's because, and Sophie knows this, we're picking on Sophie because she's a med student, or will be shortly. So that's right, show her. So the reason people don't think there's a lot of swelling out there is they don't recognize it. By the time a patient recognizes their own swelling, it's been going on a long time. And the reason a lot of doctors don't recognize it is they don't touch their patients. And that's for another episode at another time. But if you don't touch someone's ankle for a little while, you do not know whether they have swelling or not. Not the doctor, not the patient. So I guess we'll save it for another episode. But if we all go to cocktail parties and kind of press on each other's ankles, there's going to be a lot of shocked people that are swollen and don't know it. Again, we'll just leave that where it is right now. But swelling, very common in the country. Again, by the time most people recognize it or doctors recognize it, it's been there a very long time. Yeah, we all know heart failure, liver disease, lung and kidney disease can cause swelling, but those are the less common causes. We good? Okay. Medtronic's watching. Anyways, yeah, those are the less common causes. The more common cause is venous disease, because venous disease affects so many patients. And frankly, many times people will present, they'll have really good looking legs and they'll start with swelling. And it's all from venous disease. So we're all done. Okay, now watch close because it's really cool, because everybody likes their blood and guts. Ew, it's coming out. So that's it, Christina. So tell us about how the symptoms developed a little bit. Well, when you first noticed them, while we get you cleaned up over here.
Well, I've had symptoms for years. Like I said, probably since the pregnancy. All the things you said were true for me. Just swelling, just heaviness, feel so tired, my legs, and whether I'm standing for a long time, sometimes working out, because I do like to work out a lot, and I just need to lay down sometimes and put my feet up. So I'm looking forward to this feeling better for sure. Okay.
And she's going to feel like a new lady. So again, just to recap, the leading cause of vein disease is genetics. You can eat right and exercise till you're blue in the face. And so on Monday, one of our other featured patients will be an Olympic caliber volleyball athlete, Tracy Callahan from Los Angeles, California, who has pretty good looking legs, ladies and gentlemen. She's 33 years old. She's been swelling on airplanes for the last 10 years. Every seventh day that she takes off from her training, her legs hurt and they swell a bit. And so we treated her right leg nearly a year ago, actually, and she's feeling better. She had swelling that she didn't know she had, and she has two parents that have vein disease, pretty serious vein disease. And so she was suffering vein disease symptoms, didn't know it. So she's one of the other patients we're going to be featuring on Monday. Stay tuned for that. Anyway, I hope everybody enjoyed this. Christina, thank you so much. And Bailey, Sophie.
Bye.